Hi, this is part 3 of reviewing a highly cited bad paper and showing you where they went wrong. And let's dive back into where we left off. So this sentence right here, we're in section 3.1, General Physiology and Pathophysiological Effects for the Wearer of a Face Mask, because this paper is advocating against face masks, saying that they have adverse health outcomes for people, and we've been systematically showing that no, they do not. Even at the time when this was written, back in 2021, they were leveraging data in an unrepresentative way, particularly on the papers that they're citing. So we're reviewing the papers they cite, comparing it to what they're writing, and that's how we're doing our check and comparison, because this paper is a lit review that is leveraging these papers to make an argument. So if you show that the papers aren't making the argument they say, you undermine what they're saying and you basically pull it apart and show that they're full of shit. Our first sentence in question reads like this: as early as 2005, an experimental dissertation randomized crossover study demonstrated that wearing surgical masks in healthy medical personnel, 15 subjects between the ages of 18 and 40 years, led to measurable physical effects with elevated transcutaneous carbon dioxide values after 13 minutes. So this is carbon dioxide values that would be measured through the skin. So then we're going to see, they're basically saying, okay, this is like a bad thing. This is a measurable outcome that's showing that it has a negative deleterious effect or a bad effect. Let's go to the paper and see what they're actually saying. So first, this is a German dissertation by Ulrich Butz from 2005. Well, technically 2004 is when it was submitted. But this paper this dissertation should not have come up in a Publine Medline search on scientific studies and publications, particularly because it was a German publication, because they're using the terms face mask, surgical mask, N95, risk, adverse effects, and side effects in their search. So this technically should not have come up. This means that they literally found this paper and added it to their study. So this is a methodological flaw. The point of doing a literature analysis like this is that when you focus on a time period and have someone put in these search terms, they should be able to identify every single one of the papers that pulled up. And there's no way this dissertation would have pulled up. But since we live in 2025 and we have Google, we're able to do something very nice, is that we're able to read this paper despite it being purely in German by using a German to English translator. And first, what we're going to do is go through and find the highlighted parts that I already went through prior. So we're going to go So this is a study that is on surgical masks. These are the types of surgical masks they're using from 3M, and then also a second type of surgical mask from, I'm guessing, a German surgical brand, Surgine. So it has these two different types of surgical masks. They're using these old measurement techniques. Before we really dive in, the first thing about this paper is that it's not a peer-reviewed paper. It's a dissertation, so technically the committee members should have gone through, but this is not something that holds super high weight in terms of the scientific literature. So what happens typically is you publish a dissertation and then you would take sections of your dissertation, because each section should be a unified topic, and you take those topics and then you publish them in literature, and that would be you transferring your dissertation, which is just how you sort of unify your completion of degree, and then you transfer that over and to the actual scientific literature, and this author clearly didn't do that. Now, to see what this text actually says, all you have to do is copy the text and then put it in the translator. So it says the respiratory rate of the subjects tested behaved as expected within the range of physiological fluctuation. A significant change in respiratory activity using surgical mask 1 in test series B compared to test series A without a mask was not confirmed. The test trials with mask 2 and test series C resulted in slightly increased baseline values, but no significant effect was found here either. So what this is saying is that despite them testing both of these masks on the wearer, it did not have a change in physiological parameters measured. So this actually goes directly against what the authors are saying in their study. So next we'll look at heart rate. So we copied the text and then we pasted in here. and it said heart rate during the experiments was recorded as one of the control parameters. It was subject to physiological fluctuations. No significant effect regarding an increase or decrease in heart rate was observed during the entire measurement period. So wearing a mask, either of these two surgical mask types had no impact on heart rate. Next, they looked at oxygenation. So we can take this text, we can copy it over, and it says oxygen saturation was monitored and recorded as a control parameter. The measured values were all within the normal range. No significant changes were observed during the tests. So again, the oxygen values in these patients was all fine, so no impact from the mask. Next, they looked at carbon dioxide levels, where the carbon dioxide concentration under the surgical mask resulted in partial pressures ranging from 21.33 to 24.13. And they're saying that accumulation began rapidly after the mask was applied, and after removal, the values quickly fell back to the baseline value. But it's very important to note that hypercapnia, which is what they're referencing in the other study, the literature review, is at 45 or higher millimeters of mercury, the mmHg here. So this is well below that. This is still in the physiological normal range. And then due to the lack of any statistical analysis in this pilot study, it's hard to tell if this is a statistically significant increase. If we copy this sentence over, it says the result of the study showed a significant increase in the partial pressure of carbon dioxide. So I think this is a case where they're not saying statistical significance. They're saying significant in terms of their own perceived perception. In the partial pressure of carbon dioxide in the blood of the subjects for both mask types tested, the measured value increased by up to 5.5 millimeters of mercury. This increase was caused by the limited carbon dioxide permeability of the masks. But again, even going up this 5.5 millimeters of mercury, it's not clinically relevant. As we showed, they were at around like 22, and hypercapnia, when you're having issues with too much carbon dioxide in the blood, that happens around 45. So this is not clinically relevant. Means they're in a normal condition. And then also, it's not clear if this is statistically relevant. They're just saying that there is a 5.5 millimeter increase on average, we're assuming. But again, they didn't seem to run any stats in this, and they didn't show what analysis techniques, and I don't see any p-values or anything like that. So this shouldn't be leveraged in any way, especially since they're not using the word statistically significant. This is just a preferential significance of what they assume they're seeing. So again, going back to this sentence here, now that we have the paper in context, they're saying leads to measurable physical effects. There was only one measurable physical effect. Everything else did not have any difference between the two. The only thing was carbon dioxide, the heart rate, the oxygen levels was all fine. But they're saying that there are elevated levels, so we can give them this part of it. There's elevated levels, but again, it's elevated within normal clinical conditions, so it's not impactful to the mask wearers. The next leveraged paper is Citation 18 in this right here. So what it's saying is that in a recent intervention study conducted on 8 subjects, so 8, very low sample number, measurements of the gas content for oxygen, so the oxygen volume percentage in carbon dioxide, measured in carbon dioxide parts per million in the air under a mask, showed a lower oxygen availability even at rest without a mask. They're looking at this measurement using a multi-ray gas analyzer, where they're saying that the oxygen concentration in the air under the mask was significantly lower at 18.3% compared to 29.9% with the room concentration, so inside the mask versus outside the mask. And then again, they're saying that the carbon dioxide levels increased within the mask. But again, it doesn't really matter what the levels are in the mask. What's important is the levels within your bloodstream, the dissolved carbon dioxide, the dissolved oxygen levels, making sure you're getting enough oxygen in and enough CO2 out. So this doesn't actually look at that. This is a weird thing to pull in here because you're just measuring what's being in the mask itself. And if we think about breathing, you have like sort of shorter, quicker inhales, and then you have faster, longer, slower exhales. So because of this, if you have sampling speeds that aren't appropriate for the oxygen versus the carbon dioxide, you're going to be sampling carbon dioxide at much higher levels than you're going to be sampling the oxygen, because you're going to have, as it's going by fast, really quick, as it's being pulled through the mask, you're going to have a lower sampling of that than you are of the carbon dioxide, which will be exhaled at a slower rate, going and then that's going to be sampled at higher rates. So you very easily could get false signals from the measurement technique being performed. And again, it's not relevant, but we'll look at the paper still, but it's technically not relevant because it's just measuring what's in the mask, not what's going into your lungs and in your bloodstream ultimately. So the first thing when we look at this paper, quote unquote, is that it's not actually a journal paper. It's a special article, which is just kind of like a highlight quickie. So if we look here, it's literally only 2 pages long. So it does not have a sense of rigor. And we can see that really quickly when we jump over to this table, which is their only data. So what they have here is basically you're sitting without a mask, so just sitting in a room collecting measurements. You're sitting in the room with a mask on, and then you're wearing the mask and sitting post doing an exercise. And the exercise, I believe, was 21 push-ups. Yeah, right here, 21 push-ups in a public park. So they're measuring this outside. And the interesting thing is that there's no comparative analysis. So you would expect there to be measuring it without the mask and then measuring it without the mask post 21 push-ups, and then having the same thing with the mask. So with the mask and then post the mask after those push-ups. But we don't see either of those. So they're missing an arm in their study right off the bat. They don't have post-exercise without a mask on. So they don't have those parameters. And then let the person go and rest and then do that. So they could have done a paired analysis that way. So this is lacking rigor in that sense. Another very odd thing is that they didn't collect saturation oxygen percentage and heart rate normal while wearing a mask. That's very, very odd that they're reporting it for these other things, especially with such a very small study, that they're not also reporting it here. And that makes it biased because you don't have that pairwise analysis of with mask resting and with mask post-exercise. And also it makes it so that these parameters post-exercise are very high, but you don't have the comparison to post-exercise without the mask. You don't have the comparison there. So really you can't leverage this data for anything besides the basal without a mask and the basal with a mask, looking at the oxygen percentage and the carbon dioxide parts per million while you're just sitting there. But again, we're getting literal outside in a park part per million conditions, and then they're measuring with inside the mask, and this is like ridiculous levels. So it's unfortunately probably a side effect of their measurement technique, having some measuring device inside of it, and then having you exhale air directly from your lungs straight onto the device itself. So this is clearly a highly inflated number that has no clinically relevant value whatsoever. And again, the authors even note themselves, the analysis of the gaseous content of the mask and the subject interface is simply that, and therefore it is not basically this is like what I was talking about, like the blood gas measurement, but it's the study of the gaseous composition that will be inhaled. But again, that's not true because you're going to be inhaling, permeating oxygen in through the mask, which changes. And because it's probably not sampling that quick inhale of oxygen appropriately, it's not going to be producing accurate values. And it's not going to give you because you're going to be pulling oxygen in, and then that's going to be changing the levels of what the oxygen to carbon dioxide ratios are in the mask. So again, this is not we have a dissertation that is not peer reviewed, that doesn't have statistical analyses run. We have this now sports journal article, which is lacking any rigor, which has a lot of glaring flaws in it. and doesn't really give us any information itself because of the measurement technique being inappropriate for what is being considered in the article for making the conclusions towards a hypercapnia situation, having too much dissolved carbon dioxide in your blood while you're wearing a mask. So we're seeing that it's not adding up. And then to pick this apart even more, a couple interesting things is they don't say what types of masks were used or if the same mask type was used on all participants. And they also don't have a protocol of how this was performed. It's not saying where in the mask this was placed. So for example, if you have a mask, you're probably imagining something like this distance away and you have the device inside, so it's going to be very close to the face. So when they're taking the measurements without the mask on, how is it being held for recording close to the face, similar to like it would inside the mask? Is it held at a constant distance? Is it set centrally? Is the person being instructed to do their normal breathing directly onto it when they're not wearing the mask? These are all the things that need to be documented and recorded. They haven't documented or recorded any of it, so it's really underpinning how poor of a pilot study this is. And then for our last section today, the authors of the literature review say that these phenomena are responsible for a statistically significant increase in carbon dioxide blood content in mask wearers, and they cite studies 19 and 20. So we'll review those real quick and talk about those. So this is citation 19. This is looking at 10 nurses who wore an N95 mask alone, or an N95 with a surgical mask overlain on top of it. So this is stacking up. So technically, you should not be wearing a surgical mask over an N95. The N95 is sufficient enough. The surgical mask is just going to really inhibit any additional breathing. So this is going to be an increased respiratory resistance, a flow resistance, if you have a surgical mask over the N95. But let's just see what they did anyways. So most nurses in this study, 90%, tolerated wearing the N95 respirator for 2 12-hour shifts. And of note, the one nurse that did not quit after 30 minutes. Let me see if I can find that real quick. Yeah, right here. So the one subject wore it for 30 minutes and then withdrew from the study altogether. So for the people that remained in the study, there was 100% compliance, and these nurses were able to wear the respirators with no problem for 2 12-hour shifts, so very long periods of time. And importantly, the carbon dioxide levels, while increasing significantly compared to baseline measurements, especially when comparing an N95 with a surgical mask overlain on top of it, these were not clinically relevant increases, which means that there is no true effect on the people wearing them, but there was perceived exertion of breathing or perceived shortness of breath, and some complaints of headaches, lightheadedness, and difficulty communicating, which increased over time. However, of note, long-term use of respiratory protection using an N95 or an N95 with a surgical mask over the top of it did not result in any clinically relevant physiologic burden for healthcare professionals. And although many subjective symptoms were reported, the N95 compliance was very high. Again, the one person that didn't wear it quit after 30 minutes, which is basically no time at all. So basically there was 100% compliance of the 9 subjects. So of note, wearing an N95 with the surgical mask overlain on top of it had statistically significant negative effects over and above those associated with only wearing an N95. However, even in this extreme scenario, it did not have a significant negative impact over and above wearing only an N95 in relation to blood pressure, oxygen levels, heart rate, headache, lightheadedness, perceived exertion, perceived shortness of breath, perceived comfort, perceived thermal comfort, or impeded communications. Where again, the statistically significant rise in carbon dioxide levels over time from baseline to the end of the shift did not result in carbon dioxide levels that reach the clinical definition of hypercapnia, defined as an arterial carbon dioxide level greater than or equal to 45. Therefore, from a physiologic perspective, long-term use of respiratory protection proved to not cause negative effects for the nurses in this study. And another interesting finding from the study is that although the nurses did not experience any clinically significant negative physiological effects from wearing respiratory protection, they reported many subjective symptoms. So what's interesting about this is that their physiologic measures of heart rate, blood oxygen, blood carbon dioxide, those were all in normal parameters. They did not reflect any difficulty with gas exchange. The nurses still reported feeling more short of breath the longer they wore respiratory protection, which means that there's probably some sort of psychosomatic component to it, which means that their mind was making them be more attentive to the mask wearing over time. Maybe it was becoming like a little uncomfortable. Maybe they were just getting fatigued from the day, et cetera, et cetera. So a lot of times we'll hear people being like, oh, it's hard to breathe, et cetera, et cetera. But it's not actually hard to breathe. Those parameters were completely within normal ranges. It's just a subjective feeling of it being hard to breathe. It's not actually hard to breathe. You're just feeling like it might be harder to breathe because you're probably just not used to wearing the mask for certain periods of time yet. Additionally, contrary to prior research on healthcare personnel tolerance of long-term use of respirators that found that the average time that hospital personnel would tolerate N95 usage was less than 8 hours, this study found that almost all nurses were willing to wear the assigned respiratory protection for the duration of the 2 back-to-back 12-hour shifts, which is the entire length of this study. In this study, only one nurse had a very high intolerance to wearing an N95, as evidenced by them withdrawing from the study after only 30 minutes, which is ridiculous. So this is again showing like perceived discomfort is a big factor for people. And it's really just because they're not used to wearing the mask. They're not used to having something on their face, which is really what this is showing. So again, looking back to this, so while there is a statistical significant increase in the level, it's not having any actual impact on the mask wearer themselves. And again, this is with an N95 in that study and an N95 with surgical mask overlay. The surgical mask doesn't do anything, so there's no point in having that overlaid on your N95. If you're doing that, please stop. You're just going to make it harder to pull air and push air out of it by having like a barrier over it. The N95 is completely sufficient in and of itself. And then our last paper of the day, this is an N95 review in pregnant people. So it's looking at 42 women over 4 studies, 3 cohort studies and 1 crossover study, where these studies were consistent in showing no significant increase in maternal heart rate, breathing rates, respiratory rate, oxygen saturation, and fetal heart rate between pregnant and non-pregnant women using N95s for short durations. And then these were the results of the literature review. And quick aside, so see how this has a great breakdown of like the author, the study design, the number of individuals in the study, the type of masks used, the range pregnant, the outcomes measured, the exposure duration, what was tested in the study, and the key findings. Like parallel this to the paper that we're going through and see the night and day difference. This is a higher quality study right here, much higher quality. So in all of these, they're using N95s. 2 studies are focusing on the same Moldex. 3 studies are actually focusing on the same Moldex, and then the other one is a 3M. So you have almost the same exact mask being used in each of these studies, which is great for at least 3 out of 4 of them. And then you're having the same types of measurement techniques over most of them. So one is actually facial measure quantitative fit testing. So that's the different one over here. But the rest of them, these 3 are all looking at different exercises and looking at different physiologic measurements, where the short duration that they're focusing on is 1 hour, 50 minutes. But again, this is all intense exercising. So this is going to be at like a higher, if you're going to see bad results, you would see them at the higher intensity levels. than just resting like normal activities all day. So ultimately, when the authors went through everything, the studies reviewed suggest that limited duration N95 use in pregnant women results in a minor impairment of gas exchange. And again, this is at pregnant women doing high intensity exercises. And despite there being a minor impairment in gas exchange, this did not ultimately lead to notable physiologic changes to either the mother or the fetus. So again, no impact on the mask wear for either mother or child. So much so that there was no noted physiological effects on the participants. Particularly, they had an unchanged and normal fraction of inspired oxygen. So breathing in oxygen, there was no impacts on that. And the fraction of inspired carbon dioxide when wearing an N95 mask was within normal levels. So contrary to that sports medicine one, it's saying completely fine. And this is wearing N95 masks, where the one cohort study by Roberget et al. And Kim et al. Both failed to demonstrate significant physiological changes related to N95 mask use in pregnant people, as evidenced by the unchanged oxygen saturation and transcutaneous carbon dioxide levels in their patients while sitting or standing. So in this one, at low levels, no change at all. But for those same authors, they did show an increase in transcutaneous carbon dioxide levels over time during exercise among pregnant and non-pregnant people while wearing an N95. And we'll see, like in this literature review paper here, and even the authors are mentioning it here, that the reason that a lot of people theorize that there's an increase in carbon dioxide levels was due to rebreathing of the dead space carbon dioxide in the mask. This carbon dioxide retention. However, the author of the study actually disputes this argument, given that the total carbon dioxide intake was decreased due to decreased minute ventilation. So low minute ventilation means that the body isn't effectively removing the carbon dioxide levels itself. So it's an inherent buildup in the body from the exercise itself. And the two factors that sort of play into this is one, they're not taking deep enough breaths during their exercising, or two, they're not breathing at an appropriate rate. Their breathing rate could be too slow. And they're saying that those two factors are likely what's causing the increase in CO2. So that dead space in the mask likely isn't the factor that the authors in the literature review we're looking through think it is. It likely plays no role whatsoever, or a very limited role whatsoever. And an interesting fun fact at this paper here was that there was a 3% increase in inhalation and exhalation resistance using N95s. Over the course of 4 hours of moderate breathing simulation. And this increased resistance, this flow resistance of breathing air through a mask, so pushing CO2 out through the mask, pulling oxygen in through the mask, that's called flow resistance. So the perceived increase in exertion of breathing. There is a very small increase, but this would not significantly increase breathing resistance itself. And as we saw in that other nurses study, the oxygen exchange is completely within normal values. So there is a little bit of breathing resistance increase, but it's not something that would impact people. So within the studies themselves, the authors here is teeing up a thing saying, where there's this dead space in the mask that builds up this giant section of carbon dioxide in the dead space of the mask that people are breathing in, and has these bad effects. But even from the citations that this paper uses itself, it's saying, well, no, the oxygen exchange is actually normal. In the good study from the nurses study, much higher quality than this really two-pager abstract essentially in this dissertation with no real stats. So actually I did find some stats for that paper, since you saw when you download the paper, if you ever do that, it has this weird issue where when you download it, all the figures are corrupted. So that's odd, but I did find something online for at least the most relevant figure here. So right here, this would be people not wearing a mask, the measurements for the dissolved carbon dioxide levels. And then these two would be the two different types of mask groups. And they averaged these together, and it was about 5.5 on average. But again, these are pretty high error bars. So you can see at the lowest, it's down here. So that's still statistically significantly increasing, but not by a ton. And of note, you'll see that once the mask is put on, it increases, but then it plateaus. So this is a logarithmic curve. So it's going up, 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 and then it's holding constant. It's not linear. It's not increasing. So it would keep going up the longer you have the mask on. For these surgical masks, it's hitting a level and then holding. And when they take it off, it instantly returns. So it's not like a sustained effect, but that's obvious. So the interesting thing is that the average here, so they do have some error bars. There's a little bit of stats you can argue for this. But again, they're not doing like any analysis truly on this to really give you something substantial. But the average here, 5.5 millimeters of mercury increase from not wearing a mask to wearing a mask. And that's not a lot. So if you're like sitting in normal parameters, a 5.5 increase isn't going to do anything. If you're sitting at like low level, like high exercise intensity, we're seeing that was around 30. So add 5 to that. If you're wearing a surgical mask, it's going to put you around 35. So even high intensity exercise is not going to be messing up things. Really, it would just be like, you could imagine scenarios with like COPD, so severe breathing difficulties. If you were wearing a surgical mask with someone at like the upper end of these breathing difficulties, this could put you into a hypercapnia state, but you already have sort of like baseline issues to begin with. And again, this is only with a surgical mask. This is a surgical mask increase. We would expect less with N95s, which have better or lower levels of flow resistance, so it's easier to pass oxygen and carbon dioxide in and out of those. So like even in like this worst case scenario, it's not a lot, and you really have like a very small subsect of the population where this could put you into a bad level, if we're thinking about it theoretically. But ultimately, this is showing us like, no, this is not going to have any clinically relevant effects on people. So to finish up my thought from before, they're basically teeing off here saying, oh yeah, there's this dead space that's being created in the mask. There's high carbon dioxide levels being recorded in this area in the mask between the mouth and the outside world. And from this, it's resulting in an increase in carbon dioxide levels for the mask wearer, which would have a negative, they're implying would have a negative impact on people. But when we look to the actual studies, this one is junk. This one is also junk. And in the two good studies here, we're seeing that the nurses have no issues with blood gas exchange, did not reflect any difficulty issues, and the carbon dioxide and oxygen levels were within normal parameters. And then also with pregnant people, we're seeing the same exact thing where it's not going into negative parameters. It's all normal. It's all healthy parameters. So this tee-up really breaks down, and even in the one study, it's saying, okay, so there is this slight statistically significant increase in carbon dioxide levels, but there's also slower breathing and insufficient deep breaths on high intensity exercises while wearing these N95 masks in the pregnant people. And that was a result of decreased minute ventilation. So their whole argument from their own studies completely falls apart within this section. So that completes part 3 for today. Follow on for part 4.